All right, Mr. Chair, if you're ready, you can call your meeting to order.
I am not. The next person in line should begin.
Okay. And this crew that's here now, all the winter, would you like to just ask them to start the meeting?
Would I like to ask who to start the meeting? Sorry.
You all, your committee members.
Welcome, everyone. Do we have a notice to read?
I will pull it up for you. Hold on.
Thank you.
This is a pop quiz.
Bear with me 1 second.
Point of order, Alder Winter, I believe you're on mute.
I'm so sorry. Here I am just reading to myself. Thank you so much, Alder Cupo. Okay, Board of Alders notice, New Haven. The Health and Human Services Committee of the New Haven Board of Alders will meet on Thursday, March 25th, 2021 at 6 p.m. online at, should I read the meeting Zoom details, Al?
Yes.
Thanks. https://bit.ly/3E capital Y lowercase YF94 and by phone at 301-715-8592 or 312-626-6799 with webinar ID 992-8193-9427 and the audio only passcode of 4326-74337. To hear and act on the following: LM 2021-0110, resolution authorizing the mayor of the city of New Haven to apply for and accept a non-competitive grant from the Connecticut Department of Mental Health and Addiction in the amount of $36,000 for the period of April 1st, 2021 to July 31st, 2022. And it looks like that's an and to conduct academic detailing for prescribers and pharmacists, and to execute, acknowledge, implement, and deliver any and all documents as may be granted, necessary, or appropriate with respect thereto. Per order, Honorable Daryl Brackeen Jr., Chair, attest Honorable Michael Smart, City Town Clerk. For accessibility related accommodations, please call 203-946-7833 voice or 203-946 8582-TTY prior to the meeting. To view the meeting, go to the Board of Alders YouTube channel at http://bit.ly//3E capital Y lowercase YF 94, or for audio only, dial 301-715-8592 or 312-626-6799 and enter webinar ID 992-8193-9427 and the audio only passcode of 432674-337. You may send public testimony or sign up to speak by emailing publictestimony@newhavencg.gov no later than 2 p.m. the day of the meeting. And yes, I believe we have with us representatives from the Department of Public Health to speak on this item. Welcome.
All right. Can you have your committee introduce themselves?
Yes, my apologies. Yes, would the members of my committee introduce themselves, starting, I guess we'll go in order of ward number. So with Alder Sabin.
Thank you. Sabin, Ward 1.
And Alder Kupo.
Good evening, Alder Ellen Kupo, Ward 8.
Alder Hurt has joined us. Go ahead, Alder Hurt.
Oh, something is wrong. Alder Hurt's audio hasn't connected yet.
Okay, we'll go to Alder. Is Alder DeCola with us tonight? Or is it, I guess we'll go to Alder Brackeen if Alder DeCola is observing.
Alder Brackeen, Ward 26.
Thank you, Chair. And now if folks from the Department of Public Health would introduce them, the Health Department rather, would introduce themselves. Do they?
Good evening. Thank you for the opportunity to be here. Rick Saban, Director of Health for the City of New Haven. I reside at 784 Quinnipiac Avenue.
Thank you, Director Bond. Is anyone else from your team joining us?
No, it'll just be me today.
Okay, thank you, Director Bond. You may begin.
So in addition to the resolution that was just stated, as noted, this is a non-competitive grant. We were contacted by the Department of Mental Health Services to be able to really enhance our current efforts around substance abuse with our opioid initiative. And this would allow us to be able to fund a part-time position. Ideally, we're seeking to engage a MPH student that is looking for a short-term project. This is for 15 months so that we can engage providers and pharmacists on one-on-one to be able to provide education. As you know, legislation was passed about almost 4 years ago in regards to providers and pharmacists that are prescribers to enroll into a portal and to ensure that they are engaging in safe practices as well as not price gouging regarding prescriptions. So we're hoping to have academic detailing around that and add this to our current efforts within the department.
Thank you, Director Bond. And thank you for that summary. Are there questions from members of the committee, starting with Alder Sabin?
Thank you for being here with us tonight, Director Bond. I was wondering if you could talk about any long-term financial impact for the city from this.
No long-term financial impacts for the city.
Great, thank you. No more questions, Mr. Chair.
Thank you, Alder Sabin. Alder Kupo.
Thank you, Mr. Chair. Thank you for being with us, Director Bond. My only question was around, so I noticed that this was a position that would be funded by the grant from now until, I apologize, I forgot the date, but I wondered, is this position, does it have the potential for being an ongoing position? Could it be continued beyond just the 1-year contract?
So this position is scheduled to, funded for July up to July 31st of 2022. We are always actively able to engage other community health outreach worker positions through other grant funding sources. So we're looking for opportunities for sustainability for certain.
Mhm. Thank you so much. Thank you,
you.
Mr. Chair.
Thank you, Alder Cupo. Alder Brackeen.
Thank
Any
you, Mr. Chair. The only question I have is the standard question, was the grant applied for already? And if so, was the hearing paperwork submitted in tandem or beforehand?
Yeah, so we were approached right before the timeline alignment. And so we were asked to submit the proposal. It was a non-competitive process. They had additional funds that they wanted to provide to the health department. So we were sort of against the timeline when we submitted. So that was one of the barriers that we were tackling when we were approached by the funder.
Thank you, much appreciated. As long as it comes to a hearing process, we generally are okay with that.
Thank you, Alder Brooking.
Any further questions, Alder Brackeen?
No, thank you.
Thank you, Alder Brackeen. I see that Alders Haywood and Hurt have joined us. Any questions from Alder Hurt? Good evening.
Good evening, Mr. Chair. Thank you. No questions at this time.
Thank you, Alder. Alder Haywood, do you have any questions for Director Bond?
No, no questions at this time either. Thank you.
Thank you, Alder Haywood. I just have 2 questions, Director Bond. One,
You're muted.
thank you, Director Bond. Is it unusual that it's a non-competitive grant? Are there other competitive grants out there that we should
So there are opportunities within the state when there are additional funds and when they want to provide partnerships with other cities, that they will reach out to us when they know that we are actively working on similar efforts. And so we will get, periodically we'll get a phone call from either the Department of Public Health or DEMIS, as we were with this one, to be able to provide and enhance our current efforts around opioid in this particular matter. So it's actually a compliment.
Okay, that's good. That's great. That means they're interested and aware of what we're trying to do.
Mm-hmm.
What is academic detailing? What does that mean?
It's basically, it's an evidence-based model on doing one-to-one outreach to try to ensure that that the pharmacists and healthcare workers are in compliance with the regulatory requirements and also price gouging. And so it's really more of a academic detailing of using an evidence-based model towards outreach to specific audiences.
Thanks. And then one sort of bigger picture question, what are you able to say roughly for the department how much attention is devoted to COVID and the pandemic and then devoted to other things like substance use?
Yeah. We actually have a team that is devoted to working with, in conjunction with the CSA coordinators team on harm reduction efforts. We also developed an opioid dashboard where we're tracking the opioid epidemic in our city. And so it's really a partnership between dedicated individuals as well as our harm reduction team at the CSA division.
Thanks, Director Bond.
Believe it or not, we are actually working on other efforts other than COVID. I know it's hard to believe, right?
It's hard to believe that there could be anything else, but it's good to hear. Are there any further questions from the committee? Okay, seeing none, we can. Is there anyone who's lined up to testify, Al?
There is no one who is lined up to testify.
Okay. Would any members of the public like to speak on the one item before us tonight? Would any members of the public be interested in speaking on the item before us tonight? And a third and final time, would any member of the public be interested in speaking on the item before us tonight? Okay, seeing none, do I hear a motion to close the public portion of this meeting?
Motion to close.
Second.
A motion has been moved and seconded. Any discussion? Seeing none, all in favor, say aye.
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 Any opposed? Any abstentions? Okay, the ayes have it. Is there a motion on the item itself?
But you're gonna do that on the-
I don't think so.
I make a motion to approve the item as proposed by the Health Director Marissa Bond.
Thank you all. And the item has been moved and seconded. Discussion. Is there any discussion?
I mean,
Yes, Alder Cupo, please go ahead.
thank you, Mr. Chair. I think that the work that this team is doing is really important. I fully support us authorizing the application of this grant for the funds as they've been proposed to be used.
Thank you, Alder Cupo. Any further discussion from other members of the committee? Okay, seeing none, I would just say, I think, everyone has been greatly impressed with the work that the department has done as it relates to the pandemic. And, like Director Bond indicated, there are many other pressing issues that we need to be acting on. And, I think the memory of overdoses on the green and bad batches of drugs going around the city, it's still very fresh in everyone's minds, despite everything we've been through since then. And so it's encouraging to know that the state is interested, acknowledging and interested in the work that we're doing on this front and willing to award us this part-time help to advance it. So with that, we can vote. All in favor, say aye.
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 Thank you so much.
Any opposed? Any abstentions? Thank you, Director Bond. All right, is there a motion to adjourn?
Motion to adjourn.
Second.
Okay, being moved and seconded, all in favor?
Aye.
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 Any opposed? Any abstentions? Okay, we are adjourned. Thank you, everyone.
Thank you.
Great job. Great job.
Good
You
job.
Thank you.
Good job,
Thank
Steve.
Good job, Walter Winter.
Thanks,
Good
Alder.
one, Walter Winter.
Good job.
Good night,
Good
everybody.
one. Good
Right.
one. I just figured out how to put my face on. Oh my God. Good one. Bye, guys.